So hi everybody, something tricky is really happening right now. According to reports, resident doctors are beginning an indefinite strike. So it's a way of trying to control the federal government to see to their needs a lot more than they have been doing, especially in this COVID-19 period. Now, the Minister for Health, that's Dr. Osagi Ehanire, has been complaining, has been begging them by all means possible that this is going to lead to probably a lot more fatalities from COVID-19. And of course, you still have to remember that we still have Lassa fever going on in the country. There's still a Lassa fever outbreak in the country and so many other outbreaks going on at this moment. So if all these doctors are going to be quitting at this time, it's really going to drop the number of personnel that we have to deal with this issue in Nigeria, and we don't even have enough to start with. Remember, we have 200 million Nigerians on average, and then we have this a huge chunk of the doctors trying to take a quit and leave the service at this period as a strike and all of that, and it's really going to affect the system. It's really going to affect Now, before I'm just going to continue, I'm going to be mentioning resident doctors actually mean doctors training to become specialized in a particular field or in a particular aspect. So you may actually go through residency and then become maybe an optician. You may go through residency and then become whatever sort of doctor you want to become. So that's basically what it is. You're trying to be specialized and all of that. So you are going to enter your field like proper, not just some general stuff. Of course, you could still be a general practitioner, but most people would really like to go into their own field and then become a lot more understanding of what is going on in that field and become a lot more of an expert in that field. That's really what brings in the money in some aspects. So that's basically what is going on. So now all these doctors are quitting, and it's something really, really scary for Nigeria. You really have to understand that. Again, it's not like maybe there is a drug that really cures coronavirus. What actually happens is that you try to maintain and you try to manage the symptoms by giving them drugs, the patients. You give them drugs to deal with the symptoms. If it's cough, you give them drugs to deal with the cough and some other things like that, just to help them to survive long enough for their body system, that's the immune system, to fight the coronavirus, because it is basically still your immune system fighting the coronavirus at this point. There is no drug that actually goes after and kills the virus at this time. There's no vaccine yet that actually prevents you from getting the virus at this time. We don't have a good enough immunity at this time. That's why it is called a novel coronavirus. That is a new type of coronavirus, because it is not the only type of coronavirus we have. Again, the common cold is a type of coronavirus. We have different types of coronavirus out there. So this particular type is very new to us. That's why nobody has immune system against it. But if you have already had it before, there's a huge chance that you're not going to have it again. That's why it's either we all get the virus, or most people get the virus. About 60 to 70% of people get the virus. For those people who are not sick enough, for those people who are not going to be sick enough, that is those people who are young and they don't have any pre-existing condition, or for those people, just people that are not vulnerable, that's young ones. So make sure that the old ones are protected, and make sure that those people who have pre-existing condition like maybe diabetes or whatever it may be, those ones are protected, and then let every other person get it. This is something that may seem radical and may seem crazy at first, but that is exactly what Sweden is carrying out. That's why Sweden has never closed down their economy like many of the countries around the world, like Europe and the rest. Sweden did not close down the economy. All they just did was that, okay, those people that are vulnerable, let them hide at home, and those people who are not vulnerable, let them go to school. Let them go to work. They didn't close down the schools. Nothing happened. And now they're not going to be having a second spike, because most of the countries that are reopening are starting to have a second spike. That is, once you reopen again, you are exposing those people who didn't have it at the first time to start having it now. So you are going to have an increase in the number of cases that are going to be having with the COVID-19 stuff. So that's exactly what is going to be happening. But Sweden doesn't have to face that sort of a situation right now. So it's better for us to just go through that if there's not going to be any sort of vaccine. And for those people who are having hope on vaccine, everybody should be having hope, I think. But there's no assurance that we're definitely going to have a vaccine at the end of this year. Now, they have been promising vaccines coming up, but that the thing is promising, and that because it is entering a particular stage of human trial doesn't mean that the thing is going to be successful. So nobody really knows what is going to happen. Hopefully one of these vaccines are going to be successful. One of these vaccines will be successful, and by the end of the year, hopefully even before then, everybody can start having the dosage of the vaccines and all of that, and it's really going to help everybody to be able to reopen fully again. But despite all these things, all the countries that are reopening right now, this is the policy they are following, the policy of having everybody to just get the virus and let us get this thing over with, because we can't keep destroying the economy over this thing. Again, it is not a dichotomy between destroying the economy and saving lives, because if you have the economy destroyed, some people are going to lose their lives, some people are going to die from it. So many things are going to happen because people are going to lose their livelihoods, and there's going to be a spike in drugs usage, and then there's going to be a spike in waywardness, there's going to be a spike in people just committing suicide because they can't handle their families. Just imagine what is going to happen to somebody that has been able to feed his family exceedingly well, suddenly losing his bank job, and there's no way for him out right now. And again, the country is entering a recession. So many things happening that are not good right now. So it's a very, very difficult situation for so many people. It's something that we really need to we just need to get this thing over with. That's the only way to go around it right now, if there's not going to be a vaccine at the moment. Again, all the reopening, I've been saying it again, all the reopening we're having, that is the policy. No politician is going to tell you that that's what they're trying to do, but that is exactly what they're trying to do. That people who are healthy enough should get the virus, and then there's going to be a herd immunity where the virus will be able to spread a lot more, because most of the people who are going to be the carriers of the virus would have had it and would have been immune to the virus. So it's not going to be able to get to those people who are more vulnerable. So that's basically what is going on. Again, there could be corruption causing the strike, and there could just be the economic downturn. Who knows? See you.